So hello and welcome everyone to the Nurse Linda webinar. Today we have a special guest and then we'll follow up in the second half hour in answering your questions. But today we have Rasheera Dopson, who has a master in public health, and she's here to talk about some issues and some advocacy work that she's dealing with. So welcome, Rasheera. Would you like to introduce yourself a little bit more in depth? Because you just gave me some new news before we started. So tell us about what's going on in your life.
Yes, hello everyone. I just want to say thank you so much for allowing me the time here to share a little bit with you on my journey in disability rights, disability justice, and advocacy, and who I am in this space. And yeah, I'm really excited to be here with you. Kind of in a nutshell, I am a public health researcher and practitioner. By day, I do a lot of community-based research, looking at how to help mitigate health disparities within disabled populations and BIPOC communities. And then, yeah, that's my day job. And then outside of my day job, I do a lot of grassroots advocacy and consulting, and just working with a lot of disability-centered organizations and how to reach our community and coming up with effective strategies to answer some of the questions that we all have when it comes to accessibility, disability rights, representation, and all that in between. I am also a content creator. I also do a lot of social media advocacy as well, and informing and educating parents, other disabled people about disability justice issues. And I'm also a published author. I published my first book in 2020, and I share my experiences of what it's like growing up as a Black woman with a disability. And yeah, I everything in my life is disability focused and centered. And kind of speaking to what Linda was saying and sharing with my new news, I recently started a PhD program in interdisciplinary health at Northern Arizona University. So I've relocated from Atlanta, Georgia to Flagstaff, Arizona within the past week. And so I'm adjusting to all the things as a student, climate, area, meeting new people and new scenery. So I'm really excited because there are a whole lot of great things on the horizon.
So lots of big changes in your life lately, but going back a bit, and first of all, congratulations on your new endeavors and best wishes in that, because that will be very helpful in your life plan. But how did you get interested in disability advocacy, and how did you get started in all of this? Can you share a little bit about your journey and how you got there?
Yeah, absolutely. I think that is really the best part when I often share my story and experiences. I get that question a lot, and I think that's actually the most interesting part, in my opinion, is how I got started. A lot of times people think when you do advocacy, it's like something or a job that you sign up for. And I always say it was the complete opposite for me. I never asked to be an advocate. It was kind of something I was thrown into out of a personal need to be able to advocate for my own health needs. I grew up in the state of California, and then when I went to college, I ended up moving to Atlanta, Georgia, where I did completed my undergraduate degree. And the healthcare landscape of Georgia compared to California, it's completely different. It's like night and day. And I did not know that as a young 18-year-old disabled woman. And so I found myself in a lot of situations of crises where I was unable to access healthcare in my state just because of the healthcare landscape. And so it forced me to be able to have to advocate for my needs as a disabled Black woman in a state that really didn't have accessible healthcare resources. And so I got thrown into advocacy, and I just started connecting with different organizations locally in my community on the state level, and just really like trying to use my story and my voice to bring awareness to one, how we need to change how people are accessing healthcare in our local state, and then also, looking and connecting with resources on the community level to see how can we help mitigate some of those gray areas in which a lot of people with disabilities were facing in the state of Georgia. And so, I would volunteer with different organizations. I would do what we would call capital advocacy days, where we would go to the state capitol and speak with our different state legislators and policymakers on the different issues that people with disabilities were experiencing in the state of Georgia. And I did that for quite some time, just on a volunteer basis. And then about halfway into my journey, I got introduced to the field of public health, and it kind of was like a light bulb went off in my head, where I was just like, oh, public health is the perfect field for me to engage in disability policy, public health policy, and advocacy. And so from that point, I decided to go back to school, in which I got my master's in public health at Morehouse School of Medicine. And then from there, it opened up more doors. And that's when I got involved in disability related research and healthcare research. And all the pieces of the puzzle just started forming a larger picture.
And so, talking about your story, would you share a little bit of your personal story about and how you advocate for individuals like yourself?
Yeah, so my specific disability is I was born with two rare diseases and syndromes. They are considered craniofacial conditions, which are conditions that affect the head and or the face. And so these conditions consist of internal and external abnormalities and birth defects. And so as a result of having these two conditions, I have experienced not only disabilities, outward disabilities, visible disabilities, but also a lot of chronic illness as a result of having to undergo multiple reconstructive surgeries. Actually 104 to be exact. Typically, when I tell that number to people, they do that response that you just did, Linda, which is
That's a
wow.
lot. That's a lot.
It's a lot. It was a lot of compacting, issues that were present when I was born. And so having to go through multiple surgeries from the time I was born up until probably really now. I just had my last surgery in May. Just addressing some of the different health problems I was experiencing. And so having been born with a rare disease and a chronic illness, and navigating what that looks like as an adult woman, as a woman who was growing, when I was born, there really wasn't a lot of research, advocacy, education around the type of conditions I was born with. And so in 2023, science and technology is catching up. And so some of the things they have to redo, they have to adjust. But even taking that place and that level of advocacy, even on a local level, and working with my primary care physicians or specialists to, come up with solutions and how to address what my health journey looks like as I age, as I get older, as I come into certain phases of my life and what that looks like. And so for me, advocacy has been a really instrumental tool in my life to be able to advocate what I need in my health and what I need in my educational experience, what I need in my mental health and emotional journey, what I need in my spiritual journey. There really wasn't a blueprint when I was born. And typically there aren't blueprints for people who either are born with disabilities or who acquire disabilities later on in life. And so, advocacy, like I said, has been really instrumental in helping me to navigate those spaces.
Well, now, so you had these issues, and you saw problems that were difficulties, challenges that were presented, but you advocate for the entire disability community. So how do you translate your issues into combined with other people's issues and advocate for the disability community as a whole? How do you integrate all those different pieces of the puzzle?
Yes, that is a great question. And I think for me, because one, I came from such a rare condition that when I talk to people about my condition or what I was experiencing, most of the times it went over people's heads because they never heard of it. I
Right.
didn't have a common disability such as sickle cell or cerebral palsy or different things like that. And so for me, one of the strategies I used and that I found that was helpful in navigating in these advocacy spaces and being able to communicate to people and what I needed was looking at the overarching higher themes of things I had in common with other people who had disabilities, even if it wasn't down to the specific symptom or trait. I think there are overall things that all people with disabilities have in common. One of them can be accessibility, whether you are a wheelchair user or I am deaf and hard of hearing, accessibility is something that we all struggle with. It may look differently, but that's a common thing that we all can find challenges in. Another way is finding, a connection when it comes to health insurance or healthcare. Those are overarching things that people with disabilities and chronic illness are going to deal with on a generalized level. I may need a specific health treatment or something more specific to my condition, but what my health needs are compared to a person with a traumatic brain injury, it may be different, but we're still in need of that same basic level health service. And so for me, this is why I decided to connect more with the disability community at large, so I can be able to tackle some of those really high arcing issue areas, and then be able to hand over those same tools and strategies to more specific condition communities.
That is really interesting because yes, people have different problems, different issues, different concerns, and yet, like you say, there are these issues that just traverse all disabilities. So working that in is quite wonderful for everyone. So you have advocacy that you do with different organizations, which is great because that's kind of a grassroots kind of thing. And then you also have a web page, I understand. You're an influencer, perhaps we might say. I understand you do a lot online with your program. Can you talk a little bit about that and how we could dial into your program?
Yes, I always get a little like I don't know the term. I feel like influencer. I'm just like, I'm not really an influencer. I just feel like I'm just me, and this is just things that I do. And if it happens to have influence, I think that's great.
Mhm.
But I'm just Rasheera, and I always see myself as this little Black girl who just wanted to make a difference in her community, right? And so yeah, I do a lot of engagement online, and I work a lot with communities and different partners and stakeholders within the disability community. I do have a nonprofit organization called the Dobson Foundation, and you can find that website at www.thedobsonfoundation.org. We're still a relatively new organization in the building and structural phases, as if I would say. But I really created an organization that will help build social and health equity, specifically for women of color with disabilities. And this is just almost like a passion project of mine because I am a woman of color with disabilities, and even looking deeper into that intersectionality, I realized that there are some health needs and some social needs that are specific to my lived experience. And so we are always looking for partners and people who are allies, whether you identify as a woman with a disability or you want to be an ally to women with disabilities. We are always open to that. And then you can find me also. I'm building a lot more traction on platforms such as LinkedIn, Twitter, and well, I don't even know if Twitter's if people are on Twitter like that anymore, but Instagram or most social media platforms, you can find me. And I like connecting with people and communities and just whatever, I always have the saying, what I freely receive is what I freely give. So information I come across or nuggets of wisdom or knowledge that I've learned throughout my journey, I always try to share and give back to others, to make their health journey a little bit more palatable, in their own experience.
So, could you talk a little bit more about how you um, pull people together in that regard to help build your foundation or continue your work, how you expand to others and how you get other people involved, and more about what kinds of things you have people doing, what kind of specific activities do you challenge people to take on?
Yes, definitely. I think one of the most useful things I have done is, I kind of like to call myself like a fire starter, igniting conversations and dialogue by just either posing really thoughtful questions to the community, to people I'm friends online with, inviting people into the conversation, or even posing a new way of thinking or thought, especially in the disability space. So, for an example, yesterday, as I was coming from class and I was in the library studying, and I just had a lot of these small aha moments in which I was able to really just reflect on my journey as, a disabled student and now being a disabled grad student, and what that has looked like as far as me like accessing accommodations and making sure I get that support on my educational journey. And so I put on my social media yesterday that, growing up, I always thought that accommodations, it was so highly stigmatized. And so because it was stigmatized in the educational system, by the time I got to high school and college, I didn't want anything to do with getting accommodations, even though I needed that additional level of support in the classroom. And so now looking back, what, almost 10, 12 years later as a grad student, I'm learning that, accommodations is not a special privilege, but it's a right that I have as a disabled student, and how that right, it really levels the playing field for other disabled students to be able to learn in a way that is more befitting for them. And so in posing that question or that dialogue on my social media, it starts a conversation, especially for those who are parents. And we're in this season of going back to school. So you have a lot of kids who are going back to school and a lot of parents navigating those spaces and how to ask for accommodations for their children, the disabled children, or disabled students who are starting college for the first time and may not know, like, how do I bring my disability identity into this space? And so just giving them like tips and strategies and different things that I have learned on my journey as a disabled student, and also normalizing some of the stigma or the discrimination and bias that you tend to face, that when I was younger, I didn't really give voice to because I had so much shame and I carried a lot of that stigma around. But now that I'm older, I'm able to kind of demystify and destigmatize that shame and kind of use it in a way that can educate and inform people.
Well, that's fascinating to me because we have a large pediatric community of individual, it's parents of children with different levels of ability and challenges, but they are constantly concerned about this. They want to advocate for their children, but they don't know how, or they don't know what to ask for or how to ask for it, or that negotiation process. So many will go into the individual education plan and they go to the meeting, and there they are as the parent, either one or two parents in the meeting, and there's a whole room full of these educational specialists, and so they feel like they're kind of like an isolated island in this
Yeah.
sea of these other people that are all saying, we can't do that, we can't do that, we can't do
Yeah.
that. Oh, that'll cost too much money. But it is a right that children have access to different things. So do you have any tips for that community, because, or a place where they can go, a website or something that you might have that you can talk about? These are the things that you can ask for, or this is how you ask for it to make it happen.
Yeah, I would say the first tangible resource or tool that I can point parents in the direction of It's the Department of Education, and then there's a section under there, Department of Special Education, that is the federal level organization that mandates things such as IDEA, or an IDEA is that piece of law and legislation that says children with disabilities have the right to free and accessible education. And so I would point parents in that direction to really re-educate yourself on what are your child's rights in the school, because when you are knowledgeable about your child's rights and what is reasonable accommodation, that empowers you to go into those IEP meetings and be able to demand what your child needs. And it gives you the opportunity to also educate schools about school districts or your specific school about what it is that your child has a right to. And so I always an advocate on educating yourself about what your rights are, because that empowers you to be able to advocate for yourself or your child. And then I would say, another resource, and I know this is a little vague, but there are parent groups and communities out there that are constantly sharing resources and information. Facebook is a really great platform and source. Even TikTok these days, I know we have a lot of concerns about miseducation and misinformation, but there are also a lot of parent advocates out there as well who give a lot of resources and good information about what are ways and strategies they have advocated for their child in the classroom, what things they specifically need, or even on a personal level, just sharing their personal experiences and giving light to, what that felt like, what that needs, what's normal response, what's an abnormal response. Like, I think a lot of times in the disability journey, I know for me personally, I wrestled over, is this normal? Me feeling humiliated, me feeling like I didn't fit in, like, is this normal? Does everybody feel this way, or is it just me? And so for me, being able to connect with other people in the community, it really took away that isolating feeling and allowed me to come into community where I was not alone, but there were also other people around, whether they were there locally or via online community, that were able to say like, hey, you're not alone in this experiences. And that is one of the most powerful agents of I believe disability advocacy, because there's only so much that direct support services can do. But when you are connected to a larger community and being able to share space with other people who have lived experience as you do, it empowers you as a person to know that you have belongingness, you have autonomy and efficacy, self-efficacy, and that you have a place here in this world. And so that's what I would continue to encourage parents, that as you were going back to school, as you're learning how to navigate those waters and understanding what your rights are, what your child's rights are, what you're responsible for, what the school is responsible for, also encouraging parents to build that community with their children, connecting them to other disabled children who are also sharing in that space and that lived experience. So they have identity and and purpose and dignity in their disabled identity.
And I think you have so many absolutely wonderful points, but I think that the idea of getting in one of those communities on Facebook, or even within your own school, talking to other parents and talking about those challenges and how they did this, you can join together and see how you can combat these problems, but also going to that Department of Education webpage and looking at your rights for your child and printing those off and going with that, here it is in black and white. If you say, well, I read this, and you don't have that paper proof there, sometimes people kind of discount you in some way about those kinds of things. So very important points to consider. Now, you've done some research in disability rights, and what are some of the things that you've participated in that regard?
Yeah, a lot of my research is focused around what we like to call in the research world community-based participatory action research, which is a really long, fancy word to describe research that's done within the community and that is informed by community members. And so a more recent project that I was a part of was increasing capacity for individuals with intellectual and developmental disabilities to engage in research. And with that research project, the premise of that research project looked at was many times that we have research that is centered around disabilities, whether it's to find a medical solution or to better improve the quality of life for people with disabilities. But oftentimes when we're conducting these research studies, we're not actually including disabled people. And so what this project looked like is how can we make sure that research studies are more inclusive in design and format to making sure that we are recruiting people with we are recruiting people with disabilities to be able to inform how can this research study be more inclusive for them, and what do we need as researchers in order to reach more disabled people. And so that was a very informative project. We are still analyzing a lot of that data, but we got so much feedback on that project as far as, how some research studies and designs, they're not really inclusive and they're not really prioritizing people with disabilities. So we're not prioritizing their voices and their needs. And how we need to balance that as researchers, as doctors, as healthcare providers, that we cannot exclude by omission disabled voices if we say that our objective is to reach disabled people. We have a saying in the disability community that says, nothing without us, nothing for us without us. And that saying simply says that we don't want you doing disability related research or any type of disability related thing without including disabled people. We are experts in our own lived experience and our own expertise. So pull on disabled people. So those of you who are a part of the traumatic brain injury space, or who deal with spinal cord or brain injury related disabilities, you want your doctors to be able to speak to your community about what are actual people with TBI injuries, what are they going through, what are they concerned about, what is their priority. And sometimes that can look a lot differently from what the doctor's priority would be. And so making sure that those two communities are talking with each other and that they are actively building partnerships and solutions to be able to build together and find solutions that will best impact that community.
Well, and I think on that note, that is a very good point. Do you have a take-home message for our audience today? Something that they should think about, maybe how they can get involved more in advocacy?
Yeah, I would say my take-home message for the audience today is, I think you said it best, get involved, look in your local community. And when we say local community, you may be in a state or an area that you're the only one, or there are not a lot of resources. But I will say this is the power of the internet and the power of social media, that there is space for you to get connected with the community. All you have to do is Google. That's what I did. I grew up in the community, in communities where I was the only one. We did not have social media. We did not have the internet. And so we didn't have that level of connectedness. But when I got older and the internet and social media became a thing, I really used that as a catalyst to be able to find other places around me and connect to them online. And so I would say get connected, plug into the community. There are ample amount of resources out there that will help you, that you can pull from, that you can come connected with different groups, social media advocates, other disabled people. There are ample amount of resources. Utilize them and just become a better version of who you are and a stronger advocate for your community.
Well, thank you, Rasheera Dopson. You are a wonderful guest, and you've given us so much information and food for thought. And actually, you've answered some of our listeners' questions. There were some people that had written in about advocacy. And so that really was a lovely presentation and discussion. So I thank you very much, and I wish you well in your continued success and in your next journey with your continued education. And we'll expect to hear great things from you in the future.
Thank you so much. And it was a pleasure speaking with you all today as well.
Thank you. Well, we'll move ahead now and answer some of the questions that people have. So I know there was a question that somebody wrote in who had a horrible experience with their healthcare, and they were isolated and unable to get information. And one group was saying one thing and one group was saying another thing. And so very frustrated question from one of our participants. So there's some information about getting interested in advocacy. Another opportunity would be going to the Reeve Foundation, and there's a mentorship program. So you can connect with somebody else locally in your community that can kind of help you. They've been through the situation that you're going through, and that can help. Another opportunity is to contact your legislatures, so your senators and your representative for your area. Now, some people think, oh, I'll talk to these people, and they talk to them one time, they tell them their story, and the people say, oh, we're sorry to hear that. And, nothing ever happens. You have to keep on top of these all the time. You have to talk to your senators or your representative when they're in your community. You can get appointments with them to chat with them. Sometimes you'll be given an appointment with one of their aides, and sometimes people say, oh, I don't want to talk to their aide. I need to talk to the main person. But talking to the aide is actually quite beneficial because they have the senator or representative's ear. They will connect it with issues that other people in your community have that are on the same topic. They will know bills and different legislative activity that's going on within the legislative branch. And so they will connect that all together and present it in a purposeful manner so that you get more bang for your buck almost if you talk to the individual aide. So some people don't like that, but it's really much to your benefit to do that. Certainly talking to the main person is important. Don't get me wrong, that's critically important as well, but never negate the aides because they have a lot of influence on what gets through to that person. Okay, so how do we find a spinal cord injury pain specialist that can help treat chronic neuropathy pain that is hypersensitive? So if you have a spinal cord injury rehabilitation professional as your spinal cord doctor, if they have a specialty in spinal cord injury, they will know how to treat that chronic pain, that neuropathic pain. There's kind of a hierarchy of treatment. And we actually have some blogs about the different levels of treatment for neuropathic pain that talks about, things that are non-medicative and then the medications and how you kind of work through the process. Now, everybody's neuropathic pain is different. And so to say, oh, I have neuropathic pain, oh, here's what you do for that. It's not quite that simple. It's not really a straight line. You might have to work at this for a while. Medications for neuropathic pain might take 6 months to become fully active. So that can be a challenge because, you're taking this pill, a few days have gone by, nothing has changed. No, because it's going to take 6 weeks to actually get that pill up to its effective dose. So if it's a pill or if it's other treatments, but there are all kinds of treatments, and there's a hierarchy for that. If you don't have a spinal cord injury specialist or a rehabilitation specialist, neurologists know how to treat neuropathic pain because neuropathic pain comes with many different diagnostic categories. So you can also see one of those doctors. So ask your primary care specialist, say, I need to see a specialist, I think, for this, and they'll be able to refer you to someone in your community. So here's a question about what can we do to change the way people with spinal cord, how people with cervical spinal cord injuries are treated. And that's that person that has that horrible story about, one person told them this, another person told them that. They were getting the runaround from everywhere. So again, use your fire. We need you as an advocate. You have gone through the fire and have come out on the other end, so we need you. Get involved in the mentorship program. Get involved with becoming an advocate because you have this fire now to help other people, and other people need you. So, there's a purpose. that very much we need you very much involved. So join us, please. Here's a person who has tested positive for the Epstein-Barr virus, and they have severe weakness and they're tired. They need to nap. Those are complications of Epstein-Barr virus. They make you, it makes you very tired. There is no antiviral for it. They're working on one, but it's not yet out for use. It's a virus like any other virus. It gets in your body. Once it's in your body, it's in your body. It can become dormant. But once it's in there, and it takes quite a while to recover from Epstein-Barr. It will always be with you. It can flare up again at any time. So we got to hope for that antiviral to be coming pretty soon. They even had a pacemaker put in because of all this. So the fatigue goes with that. It's in its some people get Epstein-Barr virus. A lot of people get it. They don't even know they've ever had it. Some people have extreme conditions like you have had. Some people, teenagers and young people who get mono, that's the Epstein-Barr virus. So if you've had mono, you have Epstein-Barr, it will be there with you. So there's different therapies that you can do. Now, with Epstein-Barr, fatigue is an issue. So you don't want to do so much therapy or so much exercise that you become so fatigued that you just can't do. You've worn out your muscles and you can't recover fast enough to, go on with your daily activity. So talk with a therapist about different things that you can do that are not so challenging, but still will help you exercise. So people who have MS, for example, often can't do very rigorous exercise because it tires their muscles, and then it takes them too long for their muscles to recover, and then they're fatigued for greater periods of time. But there's some gentle movement, some gentle exercises that will help your body feel better, that will supply that movement input to your body. But it will help you feel better, but not rigorous exercise. So you need to talk to a specialist, a healthcare provider or therapist that can help you kind of navigate this to see what kinds of things you can do to improve your health without overexerting your health. And there was ways that you can do that. So very gentle exercise, eating a healthy diet, keeping strict sleeping schedules. If you need a nap in the afternoon to refresh yourself, it might go on for several months. Have the nap, just build that into your day, but know that you will improve over time, but it takes a long time. So that's just one of those diseases that you just kind of have to deal with, and it is chronic. So it might ebb and flow. You'll get better, and then you'll have other times when it might come back, or it might not ever come back. So just keep up with it, keep going, but know that there will be an end to it. But we don't know exactly when that end will come for you as an individual, because it's different for everyone, unfortunately. Here's a very interesting question about catheterization. This person doesn't drink during the night, but they'll catheterize when they wake up. But after drinking just a little water and waiting 30 minutes to an hour, they have a large output. So what's going on there? Well, this is a normal bodily process. So at night while you're sleeping, no, people usually don't take in fluid unless you have some reason that you have to. But your body slows down, your heart rate slows down, you're sleeping, your brain function is different. Your bowels slow down at night. Nothing stops working, but it changes the speed of activity. After you get up and you're drinking a little bit of fluid, you've stimulated your internal gut, you've stimulated your body, maybe you're sitting up, your brain is now alert, so that your body's functioning at a higher rate. And that's when you collect this huge amount of fluid. Your body's like, oh, we've stored up we've slowed down, our kidneys have slowed down in the nighttime, but now we're up and awake. We got to get going, man. And so that they start cranking out that urine. And so it's a natural thing, not anything to worry about. But yeah, it happens that way. And it seems weird, but that's the way it happens. So somebody wants to know if they can listen to the program later. And these are all videotaped, so you can listen in at your convenience at any time. Here's a person that has just become an RN. So congratulations on that. They are also a C5-6 and complete Asia B quadriplegic. So yes, people who have spinal cord injury can go into healthcare professions. So they're excited about what they would like to, how they would like to move forward in their career, and would love to get involved in this kind of nursing in any capacity. Well, welcome, because yeah, there's a lot of capacity for this. There are educators, there are case managers, and we really have a need for case managers and navigators to help people through this process. There's also, you can go into the other end, into legal nurse consulting, where some people will help write life care plans for people who've been injured, maybe through trauma, and they need help with, and lawsuits and things that go on. So there's an abundance of things that you can do. You can work on a rehabilitation floor doing different things. You might be able to catheterize people. You might be able to do treatments. Maybe if you can't lift, there might be a lifting team. So look at different organizations, look at all the ways you can fit in. There are an abundance of jobs for people in rehabilitation nursing. So welcome, we welcome you. We'll be excited to hear about how that all turned out for you. And here's a person who was diagnosed with osteomyelitis, which led to paralysis. She's only 1 week past surgery, but she's looking for resources on how she can deal with all this. There's an abundance of resources through the Reeve Foundation. Everything about bowel, bladder, skin care. We talked about medication control for neuropathic pain, if that becomes a problem. We also have resources for spasticity and just everything you can think of that's connected. So go to the foundation. There's an overall guideline book, and I imagine we'll be seeing a little link to that guideline book. Oh, osteomyelitis, look at Donna, thank you, is already on top of it. She's got the osteomyelitis webpage up there. That's a good place to start, concise. So that's a good start there. And everything that you need will be there on that website. As far as finances go, that's always an issue for everyone. Where am I going to get supplies? How is all this going to work? And right now it's a real challenge for people with finding funding for different treatments and activities. Insurance goes so far, Medicaid goes so far, and and then there's a lot of financial burden that falls on the person. So there are different funds that are out there. A lot of these opportunities have become smaller over the last few years, but there are opportunities out there. So keep your eyes open. Look around in your community. If you're looking for some extra funding, there are organizations, church groups. There are different groups in your community that help people, but you need to kind of wiggle your way around in these organizations. So for instance, you might call up, I don't know, the Lions Club. I'm just pulling one out of my hat. So, they're really good with providing eyeglasses. But you might call up and say, I also have this problem. Can you help out? And they might say, well, we don't really do that. Don't be disappointed, and don't take it as a no, even if they say no, but keep going back and find different people within the organization. You're going to find somebody who's interested in your situation, and so you can expand. So look at all those community organizations, look at church groups, look at any kind of community activity-based people, because they're happy that they're doing this kind of work to help fund other people. Here's somebody who's interested in foods specific to healing a spinal cord injury, sympathetic nerve damage. And so we tell people to eat a healthy diet. So there's a lot of different diets that are out there, but eat a healthy diet. You can go to the US government and use the food pyramid type of things, which gives a healthy diet. There's a lot of information about anti-inflammatory foods that might be helpful. There's a lot of inflammation internal in the body with spinal cord injury and with nerve damage. So maybe look at what kind of foods are anti-inflammatory that will help. And there's a nutritional page that just came up in the chat box there that will help you with, like, in general nutrition kind of questions. If you end up with a pressure injury, there's some different nutrients that you want to add to your diet to help that wound healing. But mostly eating a healthy diet and looking at anti-inflammatory foods will be the ticket for you there. Here's a question about recently I mentioned a stimulation product that should be coming out for public use purchase in 2024. And thank you for that question, because yes, they're right on track. How about that? These are the, nerve stimulation started out with the FES bicycles, where electrodes were put on a couple of muscle groups that stimulated the nerve and caused people to ride the bike on using their own body, but not under their brain control. So it was electrical stimulation that grew into implants into the spine that help people do even more functions, help the cardiovascular system, help their breathing, help them with movement, bowel and bladder issues. So that was very positive. But then some of the people got the idea, well, what if we just put the electrodes on the skin over the spine in the area of where the spinal cord injury is? And that came out with really outstanding. You don't have the surgical issues and challenges, but you just tape these electrodes on your back and people are getting function. They thought it would take people several weeks, maybe months, to learn how to use this. They put these electrodes on and people are learning just within a matter of a few therapy sessions. And also when you get used to using these and you take the electrodes off for the, you can only have them on for so long, you take them off for the night or, whatever, there's a hangover. So even though the electrodes are now turned off, they're not going, people still have this hangover of function. And so these are really taking storm. These are the ones that are coming out. And the companies that we've talked to in the professional webinars. So if you go to the Reeve Foundation Nurse Linda professional webinars, you will see interviews with the Onward company, and they have a website, and also Spinex, and they have a website. There's another company called Anuvo. I've not talked with them. There's other companies around the world that are doing the same thing. So I had somebody who wrote to me personally, and they wanted to know about going to London to this company. And I'm thinking, well, sure, that's great, but you're going to be able to get this in the United States, not experimentally, like you're going to be able to get this in early 2024. So if you look at those companies, Onward, Spinex, and then this Anuvo company that I don't know that much about, but they have a product as well. So look at those. There are other companies. If you look at spine stimulation, transcutaneous, that means on the skin, you'll find some other companies that are just starting up for this. So this is the big thing now. So if you get one of these, you won't be like you were before your injury, but you'll have much more function than you have now. So look at them, decide, it's I would call it personally a low risk. There are always risks with any kind of device that you're using and the long-term use. So there are always risks, but it's a low risk because you're not having any surgery. You're just applying this to the skin. And then you have to have therapy, so you learn how to use it. But people are really advancing with this. People are recognizing, say, when they have to go to the bathroom, urination or defecation. And the sensation that they get, the message that they're getting in their brain is different. So you have to learn to recognize these things. So there are challenges and it's different, but you get a lot of function. So it's very exciting time. And we'll be having another interview coming up in January, February. The Spinex company for our pediatric community in January, they're coming out with their pediatric. So it's unusual. They're coming out with the pediatric version before the adult version, which is usually it works the other way. They try it in adults and then they adapt to pediatrics. But the pediatric version is going to be coming out first. It's built for spina bifida. Eventually, it will include people with other type of spinal cord injury. So that is something really to look forward to. Here's a person that's interested in the removal of an ovarian cyst under 5 centimeters. Should it be removed if it's bothering the patient? I don't know that much about his ovarian cyst, except for personal experience. So, that is something that you really have to talk with your gynecologist about. Some ovarian cysts are cancerous, and it's very important to get that treated right away because ovarian cancer is a very risky kind of thing. It has a lot of consequences if left untreated. There are some that are benign, so you need to find out if it's cancerous or benign. The benign ones, sometimes they will watch over time, but talk to your healthcare professional because you will be needing more information about that for you personally. It's not like a generic kind of thing. You need to know what you are dealing with inside your body. So that is an important thing. The next question is it okay to use peroxide as a bladder flush for UTI? I am going to say, as a general answer, no, it is not. Hydrogen peroxide is it's a remedy that people have used for years and years and years. And it's really cool because you put it on a wound to clean it out, and it bubbles up and it looks fizzy and it removes a lot of dirt and debris. But from my time working in nerve reconstruction surgery, what they know is that hydrogen peroxide damages some of the cells, skin cells, nerve cells, any kind of cells. It can damage the new cells that are being formed for regeneration. So if you're trying to heal a wound and you put hydrogen peroxide, you're slowing the healing. With the nerves, you could slow the heals. With nerves, you can slow the healing. With in the bladder, all cells turn over, make new cells. Cells get old, they you get new cells. So it could affect your cell reproduction in your bladder. So in general, I would say no, based on that information. If your physician has said use hydrogen peroxide, they might have recommended it for a specific time period, or they might have recommended in a reduced rate. But in general, no, it's not used for bladder flushes. It makes sense when you think about it in the old terms because, it cleans wounds. So it makes sense that, would it clear out this bacteria? No, it really is damaging your bladder. So don't do that. Okay, so autonomic dysreflexia. How can I help my caregivers and medical team understand this and how to tell when I need help? Very important question. And it comes up a lot because it's such a foreign concept to so many people, even in the healthcare world, because as I mentioned earlier, spinal cord injury is really very rare. So a lot of people don't know the nuances of teaching it. It is taught in medical school and it is taught in nursing school, but it's kind of like, here's an hour class on spinal cord injury. So it doesn't really, you don't see it a lot. You have to recall all this information, but the Reeve Foundation is at your service yet again. And they have things called wallet cards, very important. There are 3 of them. One is for deep vein thrombosis, one is for sepsis, and one is for autonomic dysreflexia. They come in every language. They come in adult and they come in pediatric. Now, you need to take your blood pressure periodically so you know what your average blood pressure is for you, because it changes after you have spinal cord injury, and after spinal cord injury, it changes over time. And so you need to know what your average blood pressure is, because for adults, if your blood pressure goes up 20 points, 20 milligrams of mercury, you could be having an autonomic dysreflexia episode. For children, it's 15 points. it goes up 15 over the top number. So you need to know what's going on with your body at any point in time. Now, that doesn't mean you sit with your blood pressure cuff on and you're taking it all the time. But know what your average blood pressure is for you, because it's going to be different. If you go into the emergency room, I've had patients that go in, and you hear this quite commonly, and they take their blood pressure and they say, no, your blood pressure is normal. It's 120/80. It's perfectly fine. And the patient says, no, but I have a spinal cord injury and my blood pressure usually runs 90/50. So that puts me in autonomic dysreflexia. So it's important to know what your blood pressure is so that you can discern what that is. There's also this thing called silent AD, and that's where you have the elevated blood pressure, but you don't have any of the symptoms, the pounding headache, the goosebumps, the flushing of the skin, the nasal stuffiness. There's a whole lot of symptoms. That's where the wallet card comes in, because you can print it off for free. You can print off as many as you want. You can get cards from the association if you'd like a card. They're trifold. They're size of a dollar bill, so they can fit in your wallet. You can hand them out to people who are taking care of you. It explains what AD is. It explains what the symptoms are. It gives you the parameters of when emergency. It tells you what to do when the person's having AD. Number one, check to see, make sure the catheter's flowing. Number two, check to see if there's an impaction. Number three, check to see if there's something wrong with the skin. And then start looking at all the other different things. It tells you when to call for 911. It also gives information to the healthcare professional, some references if they would like to go look up. This is the scientific reasoning for why we say do this, what you need to do. So hand those cards out like candy. Just give them to everybody and make sure that they read them and that they know and that you know. So that's when, if they have that card and they're able to discern that something's going on because you can't vocalize that something's going on, or for some reason you can't say, here's the opportunity for them to know exactly what to do and the process, how to do it. It's simple, it's to the point, it's right on target. So actually print off all three of those, because they're all medical emergencies for people with spinal cord injury, from trauma, from disease, from neurological disease. 60% of people who have head injury or stroke have neurological issues with their autonomic nervous system, and they can get AD. So, be sure and have that information on hand. You may be a person that doesn't have it, but it's good to know what it is and how it works and how to treat it, in case it doesn't usually appear for maybe 6 weeks to 6 months if you've had trauma, or it can come along anytime in a disease process. So you might not have it for years and years, and then all of a sudden you do. So it's good to know about it and what it is. You don't have to be alarmed about it. It's just one of those things to know kind of in the back of your mind. This is what AD is, so I need to be alert. It can affect your cardiovascular system. It can have severe consequences. So you need to be in tune to all of that. And that actually, if you can believe that, comes to the end of our questions for this week, right on time. When has that ever happened? So I would like to thank everybody who helps so very much in putting together. Donna's on with me today. She's the one, look at her on that web chat. Man, she's on fire over there. Congratulations, Donnie. What a job. I'd like to thank our guest that we had today, Rasheera Dopson, who's so very interesting. Julie, who puts this whole thing together, and all the IS specialists. If you need to call or contact the Reeve Foundation and talk to the information specialists, they are a wealth of knowledge. I encourage you to do that. There's also on the webpage, there's an Ask Nurse Linda button. If you don't want to ask in a public forum and you want to ask me something, or it's not the webinar time and you've got a question right now that you want an answer to, please feel free to ask. I answer them all. And so I hope that you continue to be supportive for our Reeve Foundation. Please use all the educational content. As I say, it's all for free. You just need to print it off. It's it's a compendium of everything you could ever possibly want to know. So I thank you all very much, mostly to our listeners, to our faithful listeners that I see that are signed up every week. And thank you very much. See you again. Actually, coming up in a few weeks, I think it is on September 13th, we're going to have Dr. Raymond Anders on, who's going to talk about phrenic nerve stimulation for people who have complications with their breathing, maybe are ventilatory dependent for whatever reason. So I look forward to that, and I hope to see you then and also next month. Have a great time.